Chronicles for everyone. Um, so he will share with us about the journey of care, digital healthcare platform developed by the Open Healthcare Network, which started around pandemic and since then have grown all across the India and also the worldwide. Vaishak is a DevOps engineer at the Open Healthcare Network based in Kochi, Kerala. He's actively involved in the free and open source movement in Kerala and also have contributed to multiple open source organizations such as Kochi, FOSS, and ITC, Wikimedians of Kerala, and OpenStreetMap on Kerala. Vaishak has shared his insight as a speaker at several notable conferences. He's currently involved in PRAV, our community corporate instant messaging platform, and similar open source initiatives. I'll hand it to you here now. Thank you.
Yeah, hi. Thanks a lot. So, as my friend here introduced, my name is Vaishak. So, what I'm going to speak about today is Open Healthcare Network and like how we build care to empower ICUs across India. So, we also have a common slide that we could use anywhere. So, what is Open Healthcare Network? So, Open Healthcare Network initially started off as a project called Corona Safe. So, this started in 2020 as a response to the rising pandemic. So, it started small in our city called Kochi. So, initially we needed a software platform to manage the rising number of COVID cases, track the available beds, and patients, all this stuff within that community. So initially we started off simple and we built an EMR solution, and over the courses of year we realized that this has potential to grow, and since Corona got over, we named better name related to healthcare and Open Healthcare Network. So the flagship product of Open Healthcare Network is Care, and this slide will show you that. So almost all of you, I mean, in your college, if you are in CS background or anything, you might have built some random stuff, right? I mean, things I could think of is some library software or a calculator. I mean, we learn software development by building these small stuff, right? But when it comes to building software that needs to survive out there, we need to follow some standards, right? As in, there's a phrase called think local and build global. So it might be our everyday activities and everyday tasks. Even for that task, consider it as a problem that the world needs to solve, right? So more people should be able to relate to it, and we need to follow a bit more standard so that once you build something somewhere, that can be used anywhere around the world, right? So while building Care, we put that into the core of it. So as you can see in the slides, as of now, the existing EMR solution, electronic medical record solution, are very fragmented. I mean, you should see the UI and all. It's very old and it's not at all user friendly. And most of it are ERPs converted for healthcare usage. So how we differ is we build. Obviously, we are open source. So from day one, we were in GitHub, and we recently got published by GitHub's YouTube. So GitHub team actually came to Kochi and the deployed states, and they were able to cover what we are actually doing in the field, right? So open source and FHIR powered. FHIR is a standard that is adopted globally, and once you are building with that, anyone could actually use it, and obviously AI ready. Since everything is AI ready to the time, and extensible. So we also have support for plugins, which we'll come to that, and it is also a recognized DPG product. So I'm not sure if you have heard of DPG. It's a list published by UN. So the softwares that are like open source and like benefit humans as a whole, like it can be like it will be listed in this list. Then yeah, Care 3.0 is as I mentioned is powered by all this. So FHIR and SNOMED is a terms as in like all the medical procedures procedures all or the diseases and drugs, all these can be stored in a coded format. And yeah, we thought of like most of the standards and like implemented all these standards from the bottom up. Then yeah, this is also like so most of our primary users are using it from like smartphones, and that too like all smartphones. So we need to prioritize fast and like responsive design so that they can also, I mean, people who generally use WhatsApp or Facebook, they should be able to like use it daily. I'm gonna skip this. Yeah, ecosystem, I'll come to that. So as of now, Care is powering this many initiatives. So there is Care Tele-ICU. That is basically Care has a support for an extension called the Tele-ICU extension, and like with that, you can make the CMR solution link cameras to a patient so that a health practitioner can like remotely consult the patients in that hospital from far away. And there is Care HMIS, we are building that out. There is Care Palliative. It's deployed in my home state called Kerala and currently has more than like 1 lakh plus patient registration. There is obviously Care Clinics and like hey, better healthcare tools for everyone means literally everyone. It's not really specified to humans itself. We extend to Care January also. So like we have an instance running support for rescued animals as well. And yeah, primary health is also there. So yeah, as I mentioned, these are all like types of encounters that we file. So consider as a patient, there are always like inpatient in a hospital, there is virtual, there is outpatient, home health, emergency, and observations. Yeah, so for clinical data capture, we are using structured clinical forms. And see, this is a user interface. Some of the things that we could do. And as you can see, almost everything that you can think of should be fit inside like a single screen, so that while you are providing care for a patient, the data can be captured extremely fast. The number of clicks has to be minimized. Then yeah, we also have like a scheduling facility and public pages. So this is mostly implemented in Kerala Care, where we are powering the palliative care. So let's say you require palliative care assistance from the government. You can like sign up for a visit, and like the healthcare professional will come to your home and like do the palliative care for you. Then yeah, so we have administrative hierarchies and RBAC. So as you will be aware, like for healthcare data, it needs to be like secure, and like what you need to access should be like restricted, and all the patients that comes under you should be restricted to that specific set of users only. So Care can build RBAC hierarchy so that this permission issues can be securely managed. Then one of the major improvement of Care 3.0 is its customizable EMR forms. So when you are building out a software to capture clinical data, it's a pain to like keep on updating the UI as per like requirements comes again and again and again. So what we have built is that this customizable forms. So Care out of the box, if you're an admin, you will be provided with a window where you could generate forms, right? So let's say someone has a different opinion on how they should be capturing data. You don't need code level changes to actually I mean, you don't need code level changes to like create this. This is basically a JSON form, and like the admin can customize, and like we are actually also building facility level forms. So the form that is used to capture the clinical data can be like facility specific also. Then yeah, recently we also added support for labs. All these can be like considered as service requests, and like we have like recently built the integration for serum test, all these laboratory items as well. Pharmacy inventory is also almost the same, and like we have recently built the billing and accounting as well. It supports multiple payment methods, and like it's tied in with account integration. We are actually trying to bring in accounting software such as Odoo to better make this more suited for the world. Then yeah, dynamic reports. So all these data, they are stored as like tables in the DB, right? So once you require it as a printable form, or like let's say a discharge summary, with the press of a button, all the data that you have captured can be like transformed into a PDF sheet and like can be printed for the purposes. Then yeah, have you seen Excalibur? Any of you use Excalibur? Right, yeah, hey. So we also implemented Excalibur, its library. So see, within the EMR itself, we could also like do clinical drawings and charts and all this stuff. It's also like implemented in care. Then yeah, so all these data that we have can be like displayed as public dashboard as well. So let's say in the palliative care initiative, we could see district wise or like ward wise, or like you could go down the hierarchies, and like from the local government setup, we'll be able to see what number of healthcare needs are there. So most of the funds are being not properly utilized because we don't have this transparent data. So let's say someone needs to like donate some fund, or like let's say they are donating a medicine. They need to be aware that what kind of medicine is available for, is required for my specific area or stuff like that. With this, we can bring more transparency to that, and like ensure that healthcare is like properly managed. And there are of course care apps. As of now, we have 3 active apps. So the tele-ICU app, I'll demo in a moment. That's real-time camera integration. Then there is ABDM. It's something in India specific, Ayushman Bharat Digital Mission. Then there is also Care Scribe. I'll come to that. So as you can see, this might be a patient in a remote area. So in India, in the remote areas, what you might get is only a single primary health center, right? For most of us who live in a much more urban spaces or like developed countries, we might get X number of multi-specialty hospitals and all. But like for people like this, they the only healthcare solution that they could go to is this primary healthcare center, right? So for them to get critical and advanced medicine, we have set up this project called 10-bed ICU, and like with the power of that, we have actually converted this primary health center to support a 10-bed ward of ICU, so that advanced items such as like monitors and like cameras are there, and like this patient can be remotely consulted by an expert from the hub to the spoke. We are following a hub and spoke method, and all these data can be like made available here. So on top of the core of the care, we are actually building in and bringing in this solution as a plugin. So out of the box, this won't be there. You could install this as a simple plugin, and it will be available. Then there is ABDM. It's basically we could create an ABA number and like to simplify, the data that you have in a one specific care deployment can be accessed from a separate instance of care with your consent and like the ABA app, which basically works with like Aadhaar and like other Indian digital items. And Scribe. So Scribe is one of the major plugins that we have. I told you about these questionnaires, right? So for each of these questionnaires, you could simply enter your voice as input and get it auto-filled by the AI, right? So you don't as a clinician, you won't be requiring to type in each and other form components. You could speak in your own native language. So as of now, we do support all the major Indian languages. So you just have to say what you have to say in your native language, and it will autofill, your forms. And all of this is being built by an open source community, right? So as of now, we have more than 1,122 contributors out there contributing to care, and we are all building this with mostly like students or like part-time or like professionals. See, all these many people have actually contributed to care, and this is all fully built by the community, right? And the states deployed by care. This many states are have a running care instance at the moment, and like I told you before, 10-bed ICU project. These areas, like most of the remote areas, are connected to a hub that provides them much more advanced healthcare solution with the help of care. And the Kerala Care currently has around 1,200 plus primary care centers across Kerala, and they are actually touching the patient's life. And right now, more than 1 lakh of patients have been registered, and like 160K of home cares has been already conducted. So this was not replacing the existing system. We had a pen and paper palliative care initiative in Kerala from the early 90s itself. And what we are doing is that bringing more transparency and like bringing more impact of tech into this solution. And yeah, why care? So as of now, we have like almost all the major updates. I mean, we have an active GitHub repo where changes and like improvements are made day by day, and like it's being powered by students, and like like I mentioned before, and it will always remain an open source product. So you will be able to deploy it free of cost, and it's frontline first design. From the initial days of care and like OHC Network or like CoronaSafe itself, we had the help of all the healthcare professionals telling us what to do, right? So one of my friends recently told me that not all problems are like a software problem, right? So let's say there might be people out there thinking that they could solve world poverty by software, right? But if you don't know someone who has the experience on how to bridge basic healthcare, like bring primary education and like this domain specific items for solving poverty, regardless of how good of a programmer you have, you will be not solving any problems. So one of our greatest asset is the healthcare clinicians and like the frontline workers that we have. All the features that we have built till yet, and all the features that will build tomorrow also will be from the advisors and like requirements by these frontline workers. This is a video demo
Okay, vote pressing അല്ലേ ആൾ അറേഞ്ച് ചെയ്തേക്കാം. ഓക്കെ, പെയിനും ഡിസ്കംഫർട്ട് ഒന്നും ഇല്ലല്ലോ. ഓക്കെ, ഞാനിപ്പോൾ തന്നെ സ്റ്റാഫ്
This is a short demo of.
ഹലോ നമസ്കാരമായിരിക്കും. ഓക്കെ വോണ്ട് ഡ്രസ്സിംഗ് അല്ലേ, ആൾ അറേഞ്ച് ചെയ്തേക്കാം. ഓക്കെ പെയിനും ഡിസ്കംഫർട്ടും ഒന്നും ഇല്ലല്ലോ.
This is a
Sorry,
short
I
demo
can't
of
skip
our.
the video. Let me just try
ഹലോ
once.
നമസ്കാരമായിരിക്കും. ഓക്കെ വോണ്ട് ഡ്രസ്സിംഗ്
I think.
അല്ലേ, ആൾ അറേഞ്ച് ചെയ്തേക്കാം. ഓക്കെ പെയിനും
So
ഡിസ്കംഫർട്ടും ഒന്നും.
it's basically a
This is
demo
a
of what
short
we
demo
can
of
do
our new
with
feature,
AI,
Copilot
okay?
Chat.
And this is also so I could also show you the 10bit.icu website. So yeah, this is updated website of the 10bit.icu where we have like deployed all these items, KTLISU training programs, and you could just check for Open Healthcare Network, and you could spot us. And yeah, we also have like wait. The screen is weird. Okay, now mind. So that's been most of it. And yeah, thank you for having me. Any questions? Thank you.
So you got some cool stuff going on. I just have a little question about this can network. How does someone like put together stuff and build up a template IC?
I didn't get that question. Can it be?
If I want to build a template ICU, how should I go about it? And then install can.
Okay. So from what I understood, your question was how can you have this 10-bit ICU in your state or like in your area, right? So 10-bit ICU is one of the deployment of care which is created by an organization called OHC Network, right? So in GitHub, OHC Network organization is building care, okay? Care is a Django application and it has a care front end called CareFE, right? And this can be deployed to all of the needs. Like I specified like the use cases, right? Care HMIS, care palliative. Regardless of whatever you want to do, this can be easily deployed with the help of like the docs available. And like again, coming to the specific, for the government level of initiative, you need actually government to work, right? But if you say, let's say, you know someone who's running a hospital, for them to implement, you could like simply read our docs and like deploy a setup for yourself. One of the easiest method to deploy is to use DigitalOcean app platform. Our primary components are like one Django app is there that will be providing the backend. It also has a Celery beat and a Celery task. Then there is a Redis instance, and for the front end, you could easily deploy it to Cloudflare pages or anything that supports a static website, right? You could fork the repo and like deploy it from there. So it's as simple as that, right? Yeah. Thank you for the question. Anything else?
I actually have one question. You mentioned that the project is open source, right? So my question is, how does the project fund itself? And how many people are working on the project right now?
So related to funding, from the initial days itself, most of our like work is being done like in open source, and like it's being like done by the open source contributors. For funding specifically, we like the 10-bit ICU. That is a separate project, and like we have employees of the 10-bit ICU working to improve 10-bit ICU project, right? So they are like employed by the 10-bit ICU project. That's a separate entity. And there's also an organization called People First. That's a for-profit company. That is also, you might have heard of the National Education Policy. So based on the National Education Policy, it is empowering students to contribute to DPG products, right? So they are actually bringing students who need to learn software and like using that resource to effectively, improve the healthcare application. So most of it, the funding is coming from that way. I think that's it. Anyways, thanks for having me, COSCUP. See ya.
So that's it for this talk. Next talk will start in 10 minutes. Thank you for attending.